Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So today I've got a question from Jane, who says, my brother-in-law was admitted to ICU with infection in both lungs, pneumonia from influenza A, and had to be put into an induced coma. A few hours passed and they've said that his kidneys are failing and has been given dialysis. How has this happened? Is this a bad sign? From Jane. Thank you, Jane, for your question. So just for context, when patients are induced into a coma, that also means they are automatically intubated and they're put on a ventilator with a breathing tube in their mouth most of the time. And I presume that is what's happened in your brother-in-law's situation because of the pneumonia. He would have had some respiratory deterioration, probably type 1 respiratory failure with low oxygen levels, poor arterial blood gases, probably a very compromised chest x-ray, and that would have indicated to the intensive care team he needs intubation and needs to be put on into an induced coma. Now, with the infection in the lungs, the pneumonia, there could have also been signs of sepsis or septic shock. Now, what happens during sepsis or septic shock is that blood pressure plummets, drops significantly, and a patient then needs inotropes or vasopressors or fluid resuscitation or a combination of both to maintain a blood pressure that is A, compatible with life, and B, provides sufficient kidney perfusion. So when patients have a severe infection in intensive care, again, blood pressure drops significantly to a life-threatening level. Therefore, kidney perfusion, i.e. blood flowing to the kidney, is much reduced or stops completely, and that gets kidneys into acute kidney failure. So it's a common occurrence in ICU for patients that have severe infections, but also other issues even after trauma. There is a condition called like rhabdomyolysis. There's other conditions that lead to kidney failure in intensive care. So now your brother-in-law is given dialysis, so that means they're doing all the right things to remedy the kidney failure. So, they're doing all the right things from what I can read from your email. How has this happened? I just explained that to you, how it most likely happened. And is it a bad sign? Look, you don't want your brother-in-law going into kidney failure, but again, it's a common occurrence in intensive care for critically ill patients. So it is not out of the ordinary, unfortunately. It'll probably be, you need to monitor this over the next few days, see whether the dialysis is, getting the kidneys back on track. It should ideally do that. It's also a case of, can your brother-in-law tolerate dialysis, or does he potentially hemofiltration? There's two forms of, remedy for treatment for kidney failure in intensive care. If drug treatment such as furosemide or Lasix isn't working, then patients are offered dialysis or hemofiltration. Dialysis basically means a patient gets kidney filtration for 3 to 4 hours, sharp, short onset with high volumes of fluid removal, whereas hemofiltration is often over 24, 48, 72 hours, and the fluid removal happens much slower. Instead of removing 1,500 to 2,000 mils over a 4-hour period, the fluid removal might be 100 mils per hour over 24, 48, 72 hours. So it's a much more gentle approach. In both cases, blood pressure might drop. In both cases, volume might need to be replaced with, blood transfusions, or inotropes or vasopressors need to be given to sustain a blood pressure that is compatible with life and also perfuses the kidneys. So I hope that helps and explains the situation for you, Jane. If you have a loved one in intensive care and you need help, contact us at intensivecarehotline.com, call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership for families in intensive care at intensivecaresupport.org. There, you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. Also, I offer one-to-one consulting and advocacy over the phone, via Skype, via Zoom, on WhatsApp, whichever medium works best for you. I represent you in family meetings with the doctors and the nurses. I talk to doctors and nurses directly on your behalf with you. I'm asking all the questions you haven't even considered asking that are absolutely critical for you to have peace of mind, control, power, and influence, and more importantly, so that you can make informed decisions. You need the second opinion in order to make informed decisions while you have a loved one in intensive care. Part of that second opinion is we also review medical records in real time, so you can have a second opinion in real time. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are simply suspecting medical negligence. If you are finding my videos valuable, subscribe to my YouTube channel, click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next or what questions and insights you have from this video. Thank you so much for watching. This is Patrick Hutzel from IntensiveCareHotline.com, and I'll talk to you in a few days. Take care for now.